It would be unjust to categorize all 19th-century British physicians as solely driven by self-interest, aiming to elevate their social status above patient care. Many physicians of that era were diligent individuals dedicated to their patients' well-being, often tending to charity cases, without expecting anything in return. They were genuinely appalled by the deplorable living conditions of impoverished patients. This commitment to compassionate care is exemplified by the remarkable contributions of two influential 19th-century medical figures, Dr. William Marsden and Dr. John Simon. Dr. William Marsden, 1796–1867, was born in Sheffield, the son of a victualler. Despite having the opportunity to enter a lucrative drug business partnership, he chose to train as a surgeon at St. Bartholomew's Hospital. In 1827, upon joining the Royal College of Surgeons, Marsden encountered a distressing situation. He found an 18-year-old girl dying on the steps of St. Andrew's Church in Holborn, but was unable to admit her to the hospital due to her lack of sponsorship from hospital governors or subscribers. In response, Marsden established a dispensary, the London General Institution for Gratuitous Cure and Disease, in the following year. This endeavour faced considerable opposition, but it was the only London hospital willing to admit patients without sponsors, and the only one prepared to treat patients during the 1830s epidemics. Generous subscribers enabled Marsden to expand the hospital, and with Queen Victoria's patronage, it became the Royal Free Hospital in 1837. The hospital's demand continued to rise, treating 30,000 patients annually by 1844. Marsden's commitment deepened after his wife's death from cancer in 1846, leading him to establish the Three Cancer Hospital in 1851, eventually renamed the Royal Marsden in honor of his visionary leadership. Dr. John Simon, 1816–1904, trained and worked as a surgeon at St. Thomas' Hospital, earning fellowship in the Royal Society for his pioneering work on the thyroid gland at the age of 29. In 1847, he published a groundbreaking paper on the aims and philosophical approach of pathological research, advocating for preventative medicine to combat epidemics for the benefit of society. In response to the limited effectiveness of the 1834 Poor Law Amendment Act, the government enacted the Public Health Act of 1848, recommending that local authorities improve sanitation, and establishing the General Board of Health. Unfortunately, this board possessed limited authority and did little to address sanitation, particularly in London due to prohibitive costs. Simon became London's first medical officer of health, marking the first time a physician held a significant administrative role in public health. The Poor Law Boards of 1832 did not recognize the role of medical professionals in improving the health and sanitation of Britain's impoverished classes. The initial General Board of Health created by the Public Health Act did not include physicians, but rather engineers and a barrister. Simon leveraged his scientific expertise, powers of persuasion, and leadership to expose and ameliorate the dire state of London's impoverished population. One of Simon's significant contributions was in the registration of deaths. He recognized that the efficacy of interventions and addressing health issues relied on accurate and timely death statistics within the city limits. Simon sought the Registrar General's assistance, and city registrars promptly provided weekly reports on causes of death in their respective wards. This timely reporting enabled Simon to focus inspections and improvements where they were most needed. In 1850, he became a member of the Epidemiological Society of London, and in 1855, he was appointed to the new Board of Health, which replaced the Poor Law Board. The government of that time did not grant statutory medical roles during epidemics, a situation that deeply frustrated Simon, who was eager to see immediate implementation of sanitary reforms. Simon presented compelling epistemological evidence, including data on cholera rates from different water suppliers in London, to argue incessantly for the necessity of a Ministry of Public Health. His persistent efforts paid off in 1859, when the Board of Health merged with the Privy Council, and Simon assumed the role of chief medical officer. He eventually resigned in 1867 due to frustrations with government bureaucracy, but his work on sanitation brought radical improvements to the health of Britain's cities and served as a global model for public health provisions.